This is Michael Smith of MedPage Today. I'm here at the joint meeting ICAAC-IDSA in Washington, and I'm speaking with Dr. Mari Kitahata of the University of Washington. Dr. Kitahata is presenting fascinating data on the question of when to begin therapy in HIV. Dr. Kitahata, the current guidelines suggest basically a fairly low level of CD4 count as the starting point, but that's been increasing. What did you do? How did you address this question?
Yeah, a major challenge in addressing this question is a need for large numbers of patients followed over many years. And the current guidelines suggest that patients who are asymptomatic but have a CD4 cell count less than 350 receive antiretroviral therapy. We studied patients who had CD4 cell counts of 351 to 500 to address the hypothesis that starting antiretroviral treatment at this stage of disease would improve survival. We combined data from the major HIV research cohorts in the US and Canada. These are prospective ongoing cohorts that collect clinical and demographic information on enrolled participants. We looked at all individuals who had a CD4 count of 351 to 500 who had never received antiretroviral treatment and were free of AIDS-defining illness. We looked at the relative hazard of mortality, adjusting for other factors, comparing those patients who initiated the treatment immediately at CD4s of 351 to 500 versus those who deferred. Our study shows a 70% improvement in survival for patients who initiate at a CD4 count of 351 to 500, which is an earlier point than is currently recommended in guidelines. That's
a pretty impressive change. A 70% decrease in risk of all-cause mortality just from starting at a slightly higher level of CD4 count. Is there a clinical implication of this?
Yes, I think that all treatment decisions need to be individualized between patients and their physicians, but the size of our study and the fact that it included the diverse population of patients seen in routine clinical care throughout North America suggests that treatment with antiretroviral therapy, regardless of the presence of symptoms, should begin at a CD4 count of 500 or below.
I see. In your presentation today, you also suggested that you're studying the notion of starting at an even higher level.
I think emerging data about the importance of earlier antiretroviral treatment for preserving immune function suggests that initiating antiretroviral therapy even higher at a CD4 count greater than 500 may further improve outcomes. We're currently conducting a study looking at patients who initiate a deferred heart at a CD4 count greater than 500 and looking at the impact on survival. And those results will be available soon.
We'll look forward to that. That sounds like a fascinating study. Thank you very much for your time, Dr. Kitahata.
Thank you very much.
I'm Michael Smith, MedPage Today.